Since that mic is with me, I'm going to bring this down here.
Good morning. My name is Martese Chism, and I'm a registered nurse at Cook County Hospital in Chicago, Illinois. I have been a registered nurse for 25 years. What brings me to this movement? My great-grandmother, Birdie Kegler, was a civil rights activist. She marched with Dr. Martin Luther King Jr. and Congressman John Lewis in the historical march from Selma to Montgomery, Alabama. 10 months later, in January 1966, despite having received death threats, she traveled with 4 black civil rights activists and a 27-year-old white college student to a hearing held by U.S. Attorney Robert Kennedy. There, she gave her testimony on the poverty in Delta, Mississippi, and about her voting rights being denied. On her way back home from the hearing, she was murdered by Klans. They ran her car off the road. She was 56 years old. She was decapitated, and her 78-year-old mentor was decapitated. I was 5 years old when that happened. When the pallbearers rolled her casket out the church, I touched it with my little hands. I promised her I would not cry and I would not give up. My great-grandmother was called to fight for civil rights and voting rights. Now it is 51 years later, and I feel I have been called to fight for Medicare for all. In 2005, after Hurricane Katrina and Rita devastated the Gulf Coast, I volunteered to take care of patients in Newton, Texas. There was a rallying cry for health care for all. We saw uninsured diabetic patients go without diabetic medication and machines to monitor their blood glucose. We saw patients in congestive heart failure living in chronic fluid overload because they couldn't afford their treatments. We saw white folks in rural areas suffering. They did not want to talk about their suffering because they were told to pick themselves up by the bootstraps. But I kept on thinking. It's not to pick yourself up by the bootstrap. The system failed you. The government and the healthcare industry failed you because they are treating your life like it doesn't matter. In 2006, I was part of the Southern States tour for Medicare for All, from Memphis to Louisville to Atlanta. Southern folks told us about their heartbreaking stories of healthcare being denied. In 2007, we went on a bus tour for Michael Moore's Sicko movie. We watched the eyes of people across the country open as they witnessed the brutality of healthcare being denied. And more people came to us to tell us their story. In 2011, Scott Walker, the governor of Wisconsin, bought and paid for by the Koch brothers, came after unions, but also gutted Wisconsin Medicaid program, Badger Care, and funding for independent living service for elderly and the disabilities right community. We spent months marching in the snowy streets in Madison, Wisconsin, fighting against those attacks. In 2016, I spent 8 weeks touring the National Nurses United burning bus, watching thousands and thousands of people flock to Bernie rallies because of the hope that we could let Bernie and ultimately win Medicare reform for all. And lastly, in 2017 in Illinois, I participated in a 200-mile long march from Chicago to Springfield to demand a people and planet first budget, including guaranteed health care for all. This panel is about how we can build coalitions across the silos of social justice. I believe in order to win Medicare for all, we can't just see ourselves as a single issue movement. We need to embrace the labor movement saying that an injury to one is an injury to all, and also a victory for one movement is a victory for all movements. We need to organize along with the other wings of the movement for social and economic justice and make the case why single payer intersects with their issues and how gangs around their strengths, their movement will benefit Medicare for all. All these issues today intersect: immigration, labor, women's rights, fair election, mass incarceration, and racism. So can we commit to fight along organizations that fight for comprehensive immigration reform? Can we commit to fight alongside unions? Can we commit to fight alongside organizations that fight for women's rights? Can we commit to fight along with organizations that fight for criminal justice reform? Can we fight with organizations to end racism in America? We didn't win voting rights without people like my great-grandmother organizing. We are not going to win Medicare for all without organizing. That means embracing the call to fight for Medicare for all. It also means embracing all the other people in our movement for social and economic justice. The only way to win is to connect our struggles and march together towards freedom.
Well, good morning, healthcare justice warriors. My name is Roach. I'm the Executive Director of the Minnesota Nurses Association, representing 22,000 nurses in Minnesota, Wisconsin, and Iowa. M&A is now part of a new coalition of progressive organizations called Our Minnesota Future, whose goal is to shift the environment in strategic places to build a multiracial, statewide political constituency that can win and govern. The change we seek is not just one elected official, law, or program. It is a significant shift around politics and governing that refocuses the conversation on making the economy work for all Minnesotans, allowing everyone to thrive and creating a better state together. Two of M&A's most important legislative priorities are safe nurse staffing ratios and single-payer health care. We've been organizing around and lobbying on these issues for years. We have made some progress here and there, but two things have become very clear to us. No matter how powerful and well-respected our union is, we can't do either of these things alone. And even if we passed safe staffing and single-payer laws tomorrow, by themselves, they wouldn't create the world we want to live in. We need to reframe the conversation from the myth of scarcity, that resources are extremely limited and one group's gain is automatically another group's loss, to one of collective abundance. There are enough resources in our state, in our country, to make the economy work for all working families. But we can't achieve that vision in the current system that says either or. Either healthcare or roads and bridges. Either jobs or environmental regulation. Either schools or tax cuts. In Minnesota, as I imagine it must be in other states, the current debate is still mirrored in the either-or choices. Voters are conditioned to ask, what will we have to cut to pay for this priority? Rather than, how big is the pie and how can we make it more equitable? Progressive groups in Minnesota have worked very well together for many years, setting aside differences on policies and politics to support the candidates who best align with our issues. And while we have managed to elect some wonderful public officials, we have all too often been let down by those officials who forget their progressive ideals and engage in either-or governing. After the 2016 election, in addition to the crushing loss of the presidency to Donald Trump, we in Minnesota lost important legislative and congressional seats. We took this as a chance to look back at the conventional wisdom that led us to this point and to come up with something different. Our Minnesota future is new. It's not just a plan for one election cycle or one legislative session. It's a long-term power-building strategy to reclaim politics before we are run over by the right. We are living in a new era, not just a moment. And we know we need to plan and act accordingly. We can't just plan for the short term when the larger political and cultural tide is shifting everything backwards and to the right. Our goal is to set the agenda of state government and achieve it. This requires that we build a stronger, more aligned movement, challenge and change the dominant narrative, and win concrete and meaningful victories in the legislative, electoral, and corporate arenas. To win our agenda, we know we need to align and leverage our collective power for the long term, starting with electing a governor and legislators who are aligned with us and accountable to us and to our agenda. We believe politics should be people-led, agenda-driven, focused on changing structures of inequity and freeing all of us to live lives of security, purpose, prosperity, and joy. Some of our organizations focus on grassroots organizing and direct action. Others focus on policy and electoral politics. Some are labor unions, others are community organizations. And this means that we have to actively recognize and work to overcome barriers, such as competition and conflict between unions regarding issues of membership or relationships with joint employers, disagreements regarding specific pieces of legislation, disagreements regarding specific candidate endorsements, which I'll speak to in a minute. OMF has helped break down those barriers by bringing us all together to, one, create a shared narrative that links all of our work together as one movement, rather than a long list of priorities. It provides time and space to spend in intentional, strategic, long-term planning as opposed to having everyone just focused on the next crisis. It removes artificial divisions designed to keep us apart. Rural versus urban, white versus people of color, men versus women, rich versus middle class versus the poor. In regards to electoral politics, OMF has reached the consensus that if our shared goal is to build the collective power of our organizations to co-govern in full partnership with, for instance, a new progressive governor, our commitment to each other should reflect that goal. As such, organizational partners have committed to an inclusive approach to relationship building with candidates, in which, as gubernatorial candidates are winnowed from the field, organizations in relationship with remaining candidates are committing to intentionally bringing in those other OMF organizations into those relationships with those remaining candidates. And where organizations with candidates that are no longer in the race for governor, they are committing to bring their memberships into relationships with one or more of the remaining progressive candidates. So that after the 2018 primary election, all organizations and organizational members are being brought into relationship with the remaining progressive candidate. The ways in which we are building co-governing power during the individual organization's candidates' endorsement process includes sharing issue questions. An important tactical move is for us to have a shared set of questions on our questionnaires and our endorsement screenings, sharing candidate analysis with each other, sharing how candidates answer questionnaires or questions asked in the screenings, and that can be very informative. In addition, sharing candidates' flaws on issues or tactics allow us to coordinate a push on them that will make all the candidates better on our issues and on the campaign trail. We'll be doing joint meetings with the candidates, sitting down with principals of the organizations together with individual candidates to brief them on the coalition, which will be very powerful and set the stage for a genuine relationship with them in 2019. And finally, we will be developing joint plans for candidate engagement during and after the endorsement process. And should we come out of that process with different endorsed candidates, we've pledged to remember that our commitment to each other is of greater importance than the commitment to any one candidate. Right? Though we know organizations will spend significant amounts of resources on supporting their endorsed candidates, we want to make sure that there is a boundary around our work, governed by the philosophy that anything can happen through the primary, and after the primary, we will need to unite behind one candidate. We plan to continue conversations between partners about where the candidates are on issues. None of the candidates are perfect, and all will continue to need work on our issues. Figuring out together how we continue to move them and also hold them accountable to our issues will be of utmost importance. OMF events will not be platforms for pushing individual candidates. We will stay focused on the whole political strategy for the cycle. For instance, if a particular candidate indicates that they are going to take their campaign in a negative direction, that is more difficult for progressives to win in November, we can coordinate a response even if, or maybe especially if, one of the OMF organizations has endorsed that candidate. An important ground rule for the coalition is that respect for the other organizations and what is said in OMF stays in OMF. If we are privy to information through OMF that we would not otherwise know, we have to keep that information for OMF use only. Information about a rival candidate that one gets through the OMF process cannot be passed on. In addition, we will not attack other organizations who have endorsed rival candidates for that endorsement. While the OMF project will help M&A advance our individual priorities, we feel that we and our allies will get more out of this effort than just some electoral or legislative victory. We have the opportunity to work with a deep, diverse alliance of unusual suspects because we are a statewide, multiracial network of powerful people's organizations who are committed to showing up for each other, creating more power for each other's organizations and priorities. We'll gain tactical support on policy and organizing campaigns and strategic partners to build for the future. Significant partners in this endeavor are working with the nurses outside of this structure to form what we're calling the Core Strategy Group, which is the hub for our state single-payer campaign coalition. We are collaborating to build a stronger grassroots base. That means not only having support in building our organization's base, it also means connecting our base to thousands of other people and allied organizations in different communities. This alliance provides us a unique opportunity to connect with organizations and communities of color, those who work directly with issues surrounding poverty and immigrants' rights, all of whom are deeply impacted by our inhumane healthcare system, to have the conversation about single payer. We are building relationship and trust. We are working on public leadership development. In order to prevent the scenario of being let down by the candidates we supported, we need more people from our organizations serving in elected but also appointed office. OMF is working to identify and support leaders who can serve in public office and create political alliances that are willing to support them. Co-governing, not just access. The ability to think through significant policy initiatives together is central to our work. Our alliance strives to connect these different approaches across organizations and build capacity within each of the organizations so that we are stronger collectively as well as individually. In short, our work together is about creating the conditions for more to be possible. When you scan across the country, while there are states that are bluer and have more progressive public policies than ours, Minnesota is bringing together progressive movement forces to be closely aligned, to work together. At a moment when our country needs progressive breakthroughs at the state level, we believe we are uniquely positioned in Minnesota to be national leaders and to make that vision a reality. Thank you.
Good morning, everyone.
I'm so excited to be here. I'm very excited and glad that I was invited to come and speak about coalitions. And I'd first like to say that I am not a part of any healthcare coalition per se, and so I am here hopefully to be more of a resource, giving you a little bit more of my background. I am the state director of the Make It Work campaign, which advocates for affordable child care, equal pay, and paid family leave. I'm also a board member for the Progressive Leadership Alliance of Nevada, which spends a lot of time on immigration, minimum wage, and mass incarceration. I am the first vice chair of the Clark County Democratic Party. We concentrate on Democratic stuff. I am also on the board for the City of Las Vegas, the Development Recommending Board, which concentrates on grants that benefit the constituents of the city. I'm also the Southern Nevada co-chair of the Nevada Women's Lobby, which we concentrate on women's issues, including domestic violence and paid leave. And then I'm also on the Coalition for Women's Equity, which is women's equity. And so I say all that to say is, one, I don't know why I bite off so much on anything, but I want to show just how everything kind of intersects. Like nothing is exactly the same, but these are layers of our life because we're not, one issue people. We have multiple issues on any given day, and so we need to be able to tackle those things, where they meet. And so I'm hoping that for the majority of the time that we have up here, that I can again be more of a resource and find out what it is that you need and what it is that you have questions about, because I do realize that when it comes to starting something from scratch, I started Make It Work in Nevada. It's a national organization, but when it landed here in Nevada, nobody knew what it was. I barely knew what it was. It just sounded really cool and I wanted to do it. And so we built it from 2015 upwards, but it takes buy-in. There are folks that I already knew here, and then that were deeper into the political landscape and deeper into the C3 and C4 parts of things. And they're like, well, what are you doing? And I'm like, well, I'm not exactly sure yet. This is kind of what I want to do. And so they're like, okay, well, get back to me when you have a concrete plan. But when do you ever have a concrete plan? Because this type of work changes so often, because you never really know what the federal government's going to do, what your state government's going to do, what your local government's going to do, what policies. It seems like there's always something coming up that we need to flag. And you want to tackle so many things because they all feel so urgent. So I think I understand, if anybody has tried to reach out to someone locally, a nonprofit or, a politician, and the door's been closed in your face. Things can get a little bit cliquish, very high schoolish, and I think a lot of that, I feel like we have to give the benefit of the doubt on both sides. They're looking at new coalitions or new organizations as why are you here, and then the older coalitions, they've been around so long, a lot of them are just really, really jaded and really overworked and tired, and so they may not put their best foot forward. Does anyone here have children? Yeah. Anybody have more than one child? Okay, so I have 3 children, 3 daughters, ages 18, 14, and 10. And they're all very different people, extremely different. They have different personalities, they have different likes and dislikes. And, what you realize, as you get into the weeds of parenting is that you can't parent them the same. You are the same person with the same brain and the same mind, but you have to switch it and change your personality or change how you speak to them or change how, what type of punishment would work for them or what type of reward works for them, because one doesn't work for the other kid. So I think it's the same with coalitions. When you walk into a coalition, you want to sit at this table, you have to say, okay, this is what I have to bring, and they say, okay, well, we don't really need this. Okay, well, what do you need? So if we can spend more time listening and trying to figure out, what you have in your toolbox, because you probably have more than what they are assuming you have, and you may not even realize what you have, and vice versa. And sometimes some coalitions just don't work out very well, and that's okay too. Like a relationship, sometimes you just gotta let go and move on. And so I feel, really, really strongly that anybody with this many people in a room with this much passion, that you came down here and you're going to spend all of your time working on this, that you've made step 1, step 2, step 3, and so I don't want anyone to give up because they get the door slammed in their face, or because they feel like, these coalitions aren't inviting me in, and, they aren't really welcoming, because it may not be, and so hopefully some of them, are, but if they're not, then I just don't want people to get discouraged away from, what truly brought them here in the first place. And so I'm going to yield the rest of my time so that when we move on and people have specific questions, that it's easier for me to feed off that than to just rattle on to you about stuff you may not even actually care about. So thank you.
Good morning, everyone. Happy to see all of you. Thank you for having me today. What brought me here to this conference? It's been an interesting journey for me. Honestly, I don't recognize myself right now at this point. Yeah, it's weird. So for the past 10 years, I've lived out here in Nevada, and I've worked in the nonprofit sector for the past 10 years in different industries, whether it was for women's relations, women's health relations, caregivers relations, Parkinson's relations, at-risk youth, foster care, politically, and I've seen quite a few different things. And one of the things I've noticed while working for the Parkinson's community is that there isn't enough support there as far as with the caregivers communities. And so while I was working with the Nevada State Respite Care Coalition, ran into a lot of issues with funding. As we talk about healthcare for all, when you look at the caregivers community, they're not really labeled as a specific job title or heading to where they get federal funding. They don't have funding to take care of their families and things like that. So when it comes to them receiving health care, receiving, finances to help take care of their loved ones, to help take care of themselves, they're really at the bottom of the barrel in a lot of ways. And so that's an issue we're running into. And one of the sub-issues of caregivers is that once they do it, it's like a double full-time job. They start taking on some of the symptoms of their patients. So, and they have no coverage to go see a doctor, to get therapy, to now care for or have preventative care for the symptoms that they're showing now. So healthcare for all, when we really talk about that, looking at those communities that are doing full-time jobs that have no place, and making sure they're not forgotten about, making sure that they have coverage and the specific reasons why they need coverage. It's a community that is suffering. When I worked with the Parkinson's community and looking at how they're treated, most people think of Parkinson's as a 50 plus, 60 plus affliction, a disease. It's not. When you look at early onset Parkinson's, it's affecting 30-year-olds and 20-year-olds. And they have no idea how this is coming about. They have no idea what treatments are out there, and the treatments that are coming up from these pharmaceutical reps are so expensive. They endanger a lot of parts of their bodies that are healthy. It's like, how are we covering this community that's growing when we talk about healthcare for all? How are we getting supportive information and education for people that are afflicted with Parkinson's, with new diseases, when our industry really isn't caught up on why this is happening? So for me, healthcare for all needs to look at those underlying reasons. Also, for me, what I found out in Nevada, since we work at an at-will employment state, that's something that's really discouraging, because there are a lot of companies here that can fire you without reason, that don't have to provide health care to you. And they keep you at a part-time level, part-time job, minimum wages, so you don't have health care and you have to show up to work no matter what, and you getting sick isn't an option. Because if they find that you're too sick, we'll just fire you. Not without, any real reason for termination, just the fact that you're too sick and we don't want to deal with you anyway. That's an issue for our state. And so looking at how do we help more corporations, more people unionize in these companies. One of them that's horrible is TJX companies here in Nevada. So TJX companies, your Marshalls, Ross, TJ Maxx, all those good old folks. I used to work for that company. I have a lot of family members that work for that company. Insurance premiums are horrible. Coverage is horrible. They fire you without a moment's notice. Anytime there is any talk about a union coming in through the door, it's discouraged because they see it as, oh, you don't want to unionize because, you won't have, as much connection with your bosses as you want. And, they're just going to take away everything, and there's going to be dues, and there's going to be this, and there's going to be that. But a union would protect their employees, which that company is not looking forward to doing because they use us as expendable pieces to help with their for-profit company. So healthcare for all, especially in the state of Nevada, and when you look at these sub-communities that people aren't even looking at how to fund, how to educate, how to bring awareness to, it gets a little bit deeper in the state of Nevada and probably in other states. So, the coalition building behind healthcare for all, we really need to look at all these tiny little pieces. Because as we talk about healthcare for all, we're really talking about dismantling and collapsing a pillar of our American life. And that is tough. Because our system doesn't work on preventative care. It's last minute care. It's keep you sick care. So as we're talking about healthcare for all, we really have to look at who we're pissing off in a big way. And who we need at our table to have our backs, and what can we give up to let them know that we have some buy-in to this. We know what we may have to sacrifice because we're taking on a huge giant. There's so many layers to this healthcare system or sick care system that it's going to take all of us combining our efforts, our strength, our knowledge in different areas, in different communities to really shove the truth down our representatives' throats. Because what I'm finding is that the people that are against healthcare, it's like, so you care nothing about your family. That's interesting. That's really heartless. You care nothing about your neighbors. You just don't care. And I don't really think that's the case, but a lot of them are scared. We are talking about collapsing an industry that has held up this nation for a very long time. So we really need to be smart, but be vicious because we care about, our safety as American people, about our actual health and preventative health care. I've listened to a lot of people talk about, going into the doctor only when it's too late after you discover, oh, I have stage 4. What the hell? If everyone had health care for all, there is no waiting to stage 4. Let's get it at stage 1. When we look at veterans who don't have health care, who need access to health care, there shouldn't be anyone lying on the street, dying on the street. I should be able to walk into whomever's office, a primary care physician, and get the care that I need to help prevent it from getting to a stage where it's too late. These are things we have to combat, locally in our legal system. And a couple weeks ago or last week, I had the opportunity to go to court, because sometimes I sit in as an advocate. Because after sitting on a grand jury for a few months, you see a lot of stuff. A lot of law gets put in front of your face, and you're just like, that's baloney. That needs to be changed. But sitting in on this case, the judge said something, and I was like, wow, we need to change that in Nevada. He said, at one point, does it become malpractice? There's no definitive line in the state of Nevada on how long should it take a physician, your check-in at the emergency room, or whomever has care over you once you enter into your doctor's office. At one point, does it become malpractice or neglect? That they didn't pay attention to your patient history, they didn't run further tests because of your patient history, they didn't do follow-up checks because of your patient history, and then when it's too late and someone passes away, there's no definitive line on when the hospital or the practitioner or the nurse or the state becomes liable. That is a problem. That is willy-nilly across the board. Anyone can do anything. And at the end of the day, who's liable? Is it your fault, the patient? Most prosecutors will argue it's their fault. And that's what I heard. But the judge was like, how do you expect me to make a decision? You're telling me that this woman's emotional grievances are null and void. You're telling me she doesn't have reason to sue you, but I'm looking at, there's no line. So now it's up to me to decide whether her claim is valid versus yours. That should not be. Our medical care providers, our doctors, our hospitals need a line. They need a line because then you're opening yourself up to so much liability that can be placed right back on you, the patient. So those are things we need to be focusing on as we build these coalitions. What are our state laws? What are the policies within hospitals, within our practitioners' offices? Where do we stand actually? What are our patient rights? A lot of people don't know what their patient rights are. They don't know when to fight, that they can fight. Like someone was saying earlier, how many insurance claims are overturned because somebody decided to fight? Too many people don't fight, don't think it's their right to fight. That has to go. So as we're building these coalitions, education really is the key. Getting people confident enough to stand up for themselves. It's their right to stand up for themselves. It's their right to say no to that type of treatment because you don't want it, you don't believe in it, you believe there's a different way. Not having a doctor tell you, no, it's my way or the highway, take this pill or go somewhere else. We have to do more. We really have to do more. We have to start looking at how are people affected on the ground. Healthcare is a huge overarching umbrella. When you look at these families every day in the court system, what they're battling, in the doctor's offices, in the ER rooms, when you pay attention to that, you'll really start to see where the issues lie in policy and legislation and what our states are allowing to happen little by little because no one's checking there. So that's why I'm here today.
I just want to say thank you to all of our panelists today for talking about this. We have a lot to think about. This gave us a lot of different issues. For me, one of the reasons I wanted to do a coalition panel, or we felt like it was an important thing, is because as a mother, but also, you know, I am a caregiver. I take care of kids while their parents work. There are two things that society is built on, right? At least that's the way I look at it. It's healthy people, healthcare, and education. And I think that when we get down to the root of it all, regardless of where we come from, what state we live in, what city we're in, Chicago's dynamics are different than Las Vegas. Minnesota's dynamics are different than Chicago and Las Vegas. At the root of it all, we all are focusing on something where we have more in common than we have different. And if we all can remember that and come from that place, I feel like we can make a lot of headway. Thank you.
All right, here's where things are going to get interesting. We get to play some musical chairs. So, we're going to do this in a couple stages. First, everyone who's agreed to be a table facilitator, stand up and raise your hands. We need to make sure that there's not more than one of you at a table. All right, so if there's two of you at a table, move over to a different table. And if you see a table without a facilitator, for those of you who have signed up, adopt a table that doesn't have a facilitator yet. Sorry, everyone, facilitators, you got to keep your hand up, otherwise we don't know which is